The Northern Territory government has reversed a decision that would have seen travellers stuck in major towns when its borders open next week. Tourism operators were furious about the policy that restricted arrivals to high-vaccinated areas.
They're some of the Northern Territory's most popular tourism destinations, but the Kakadu and Uluru National Parks had been off limits in the NT government's plans to reopen borders on Monday. After almost a week of backlash, the government has reversed its decision.
Working together with the health experts, we have been able to make some modest changes that should make a big difference.
Last Thursday, Chief Minister Michael Gunner announced anyone arriving in the NT would need to stay in Darwin, Alice Springs or Katherine for 14 days. Travellers will now be able to travel to any area with a double vaccination rate of more than 80% for residents aged over 5. With Mr Gunner on holidays, Acting Chief Minister Nicole Manison announced the news.
You can go to Uluru, you can go to Kakadu, you can go to Litchfield, you can get about the Territory, as long as you are fully vaccinated and you get your COVID tests done.
66 Indigenous communities will still be off limits, but exemptions will be given to essential workers and boarding school students who are returning home.
What you've just heard from the Minister is somewhat complex but simple.
The changes were announced as the Northern Territory recorded 11 new COVID cases. 4 are linked to the Katherine cluster, which has grown to 94. They include a mother and her 10-year-old son who tested positive after travelling from Timber Creek near the Western Australian border to the Royal Darwin Hospital for surgery.
There will be exposure sites from these 2 cases. We know they stayed in Katherine and they caught a bus to Darwin.
Authorities are urging anyone with symptoms to get tested. Matt Cunningham, Sky News, Darwin.